Thank you for joining us for the breakout session. Super excited to introduce two individuals who are doing incredible work in partnership together. Tim Getze, the EVP of Performance and Integration at Gillette Children's. You're going to have to explain to everyone what that means, because what I have established is that every department at Gillette Children's reports up to Tim somehow. And Carrie King, one of our phenomenal solutions delivery managers here at Notable. So I think to get started, Tim, do you want to give us a bit of background on the organization? Gillette is such a special customer of ours, an opportunity to partner with you all. Would love to share with the room a little bit more about y'all.
Yeah, that would be great. Gillette has actually been around for about 126 years now. We started really as the first specialty hospital, we feel, from our research in the United States. So we've had a long history of care for highly complex conditions. We serve about 26,000 unique patients a year. All of that is specialty care. We don't do any routine primary care or anything like that. You could argue that our patients see us the most, in that sense that they're a primary interaction in the healthcare market, but it's all specialty care, heavily surgical based, and the complex conditions we see mostly around spine issues and cerebral palsy. Those are the two main conditions that we treat.
So highly complex episodes of care, unique challenges as you think about patient flow and digital technology tools.
Yes. So our footprint is small in the number of patients, but the level of complexity that we have, I talk a lot about how we have all of the complexities of a huge system, but we do that in a smaller footprint, which gives us some unique challenges from an implementation standpoint and those types of things.
So one of the reasons that it has been such a joy to watch these teams work together is, I think, truly some shared values across the organization. So Tim, I'll let you walk through Gillette's values. I think everybody in the room probably heard ours earlier today.
Yes, definitely. We've had these values in place for a couple of years now out of our rebranding effort, but I think the principles behind them have long been a part of Gillette. The care that we provide our patients is not really done on an acute basis. When somebody's diagnosed with cerebral palsy at the age of 3, then that means we're going to be with that patient pretty much their whole life, into adult care. So we really try to focus on being a dream accomplice, helping every patient kind of tell their own story and live their own story in that journey, trying to build a better world, embracing the bigger picture, and acting first from love. So that's how we approach our care model. And I think you do see the alignment there with Notable's value system that they shared earlier.
And so highly complex patient population, obviously, as you all think about what it takes to implement technology, what you would want to layer over your EHR and others, how did you think about, partnering with Notable, and what were some of the principles as you entered into the partnership?
Primarily, we wanted someone who would listen, because so many people want to come to Gillette, think they've already got, the healthcare model figured out, but that's not really the case with our kids. And we've had a lot of challenges with partners over time, just wanting to kind of cookie cutter us into the same type of implementation model that they would do at a large healthcare system. So it's not just the complexity of pediatrics, but also the complexity of the cases that we see. So we were really looking, like I said, for someone who could sit down and listen to us and help us and have us describe what it is like to deliver patient care to these patients and families, and have them listen to us. And I think we found that partnership and Notable from the very beginning, really. They didn't come in thinking that they already knew Gillette. They came in, okay, this is different, so we really want to understand it before we dive in.
Awesome. Well, Carrie, would you like to walk us through some of the work that y'all have been up to over the last, is it 12 months now? Longer. Almost? Okay.
So, turn my microphone on. So, September 28th, 2022, we got EHR access. It's like an anniversary date for me at this point, I feel like, because we've used it as a measurement for so many different things. And then we went live on November 4th with our showcase site. So there was a pretty quick turnaround from access to implementation. From there, we rolled out at the rest of the Gillette locations over the next 3 weeks, making sure that we went quickly so that we could ensure like a unified patient experience, regardless of which clinic you came into, because there is a lot of movement between clinic to clinic. We also were working very closely with the Gillette team to make sure that we could sunset some of their vendors at the end of the year when the contract expired. And it's very important to us to make sure we're helping Gillette maintain that mission as well. So we had some configuration work that went into some of our broadcast messaging functionality. We turned that on at the end of the year. And then there's a couple things that I would just highlight here. We've got the Flow Studio and Flow Inspector access. That's in notable terms, relatively new, I guess in traditional terms, not notable terms, a relatively new functionality that we have that allows our end users with the appropriate access to go in and see like what's going on with the different outreaches and be able to respond to things in real time, like checking on phone numbers and things like that. That was very empowering for the Gillette team to have that in front of them instead of having to log a ticket. So we saw some great results with that. We also did several optimizations as well. There's a couple things that are specific to Gillette that we wanted to make sure we were able to accommodate. One thing is that there's not an interface between the EHR and their document management system. And there are a couple things that we can do, like with the consent process, to avoid having to take on the cost and the time of another HL7 interface there. So we worked through some of those pieces as well. We're also working on a very exciting scheduling project right now. We're live with a few orders. As you can imagine, scheduling at Gillette's a pretty complicated process. We've got a lot of episodic care with PT, OT, speech, things like that, recreational therapy. And we also have visits where there's imaging attached to that visit as well. So we need to make sure we're scheduling the imaging with the ortho visit, all while making sure that that's a completely automated process, not creating additional work queues that someone has to go clean up, and making sure the appropriate documentation is attached to the scheduled appointment as well. So Gillette's a development partner with us there. They're the first organization to roll this out, and they've been great at helping us develop our workflow around the work queues and how that's going to work in real life. And we're going to be able to replicate that with other customers as well and really fill a gap with online scheduling that no other vendor out there is able to address right now. So very exciting stuff.
So Tim, what did this journey look like for your teams?
I think we've been in this hand in hand from the very beginning. And I think that's one of the great things about the partnership is that we kind of approach this journey together. And especially the development piece, which was really exciting for me because as Carrie was indicating, our type of scheduling is really difficult. It's not a situation where you can call up and say, hey, I want a primary care appointment or something like that, and you just search and get it. It's all order-based scheduling. And approaching that as a partnership was something that was really exciting for us because we were not finding anything that would work for us out in the marketplace.
Okay, maybe go back one slide. You can talk through kind of where we've been from a solution perspective and where we're going to really fully take the patients and their families through the full care access journey.
Yeah, and I think we'll obviously delve into a lot of this later on, but the really important thing for Gillette from the get-go, they're very clear about this, is their primary focus is on the patient and family experience. And that's going to be the driver for how we make decisions as far as where we focus our time and effort, how we arrange schedules and things like that, working to address those concerns and reducing friction for families who are managing complicated conditions. So we started with registration and intake. It's a pretty traditional place for us to start with a lot of our Cerner customers, and it helps us not only train families about engaging with Gillette through text messages and emails, but also train the staff as well so that they understand how they can work with this tool instead of duplicating work and things like that. So it's a great launching point for us. Right now, we're also, like as I mentioned, working through the scheduling piece as well. And we're scoping out the work for authorizations and referrals as well. As you can imagine, the referral process at Gillette's very, very complicated. I think when I was doing some shadowing, it was really interesting to learn that if you even have like the level of specificity of an ICD-10 code, that still doesn't get down to the level of detail about which provider you schedule with. If that like gives any indication of like the complexity of care here. So there's a lot of manual work that their team is working through to make sure that these kiddos who recently received pre-serious diagnosis are able to get in and get seen very quickly. And we're excited about the opportunity to automate some of like those more manual tasks so they can turn that around even faster.
Tim, what has been some of the feedback from the families?
The families have been great, and our satisfaction rates, I think, are still at 99% from the get-go and highly engaged. And I think that's because this is part of the entire family's journey. This is now, life impactful for them when you receive a CP diagnosis or a scoliosis diagnosis or things like that. So we found that as soon as we turned it on, as soon as people started, they finished it, and the satisfaction rates were phenomenal. And that stayed that way from the very beginning. And I think the point of starting with registration, talk a little bit about that if I can. The registration process at Gillette has traditionally been really hard in the sense that the insurance complexity of these families that they have is complex, and it changes quite a bit. And even just getting into the hospital for a visit, a lot of times the kids will have lots of assistant equipment. They'll have siblings that have to come, transportation issues with the family. It's not an easy thing to come in for a clinic visit. And when you come in and then there's 10 people in front of you, all with those same, challenges, it's really hard. So it was hard on our staff. And the way that we're set up, like my administrative office is on one side of the campus, and then if you have to go to the inpatient side or the cafeteria, you walk right by our largest outpatient clinic, and I would walk by there, and see the lines, or my CEO would text me, all the time, hey, the lines are really backing up here. And so it was a really great place to start. Now I walk by there every day and we have no lines, It's been an amazing experience. And it changes the way that the staff interact with the families. Because if you're that family and you've got two siblings and your kiddo there, and by the time you get up to the line, you're probably a little irritated. So the staff don't have a good experience. The family's not having a good experience. We find that dynamic has shifted dramatically. So the families come in, they get checked in, or are already checked in online, and that whole experience has been great.
Carrie, if you want to forward, maybe Tim will have you walk through some of the actual results that you all have seen thus far.
Sounds good. So I want to start with the column, I guess on the right side. I need to do my L's to make sure I'm giving good instructions here. So the started to completed rate for pre-visit, that's one of the ways that we measure what we need to modify within the pre-visit experience to achieve better results. This is a phenomenal rate in that we're not seeing any drop off there. So if someone is opening the experience to register, they're finding the process easy enough to complete quickly, and they're getting through it, which means that we get the complete information on the back end, and we really see the impact of having patients come through that process. We also have the patient satisfaction rate here, which is probably the most important metric that we watch, making sure that families find this valuable and that it's a tool that they're able to help manage some really complex conditions, and it makes their life just a little bit easier there. And then the last one here, the 3 to 5 minute reduction at check-in. As Tim mentioned, there's one single point of entry for the St. Paul campus, and any sort of backup there really is impactful for staff and families too. Not only are we saving staff time by working through the notable process and paper, by having the consents automated, all of that, we're really allowing the front desk staff to connect with families in a more meaningful way and be a more engaged part of their care team. The way the St. Paul campus works, the different clinics will rotate to different spots throughout the week, and you need to go check in at the front desk to get instructions about what waiting area you need to go to, things like that. And it offers a really great point of contact for the front desk staff to be able to see what's going on with families, and it also allows them to feel the overall values that Gillette tries to imbue here, where everyone is trying to lighten the load with these families and make things possible for these kids where other people may not think it's possible. So really like feel good stuff too. Like when we're like looking at the numbers, it's maybe not like a clear percentage metric, but the impact there is really profound, I think.
Yeah, and these metrics Carrie mentioned, these are astronomically high, the highest of any of our notable customers. I think we strive to get there with many other organizations, and that's part and parcel to the intensity of these care journeys for these families, right? They're going to complete it because, we just talked about some of the burden if they do not. But I would say the other piece of that is the extreme care and time that the Gillette team has put in partnership with Notable to get it right. What are how do we continue to strive to take that next half a point off to make sure that we're truly delivering an experience that is lightening the load for these families, and they can do on their time, and make sure that the teams can provide better care when they arrive. Tim, your teams, I would say, at least part, Carrie, you can speak to the team where Jen is not with us here today because she had some personal commitments, but a part of the keys to success have really been the partnership with your teams. How have you thought about structuring your project teams, or what are some of the things that you've found have been super successful, and maybe not even just with Notable, but in how you will have approached implementations and technology partnerships to get through these results quickly?
Yeah, we've really evolved over the last 5 years, I would say, where I did come in, started as the IS person, and we had a failed EHR implementation, so I had to kind of confront that and deal with that, and tell everyone, well, there's no way to fix it. We're just going to have to start over. So we did that and went live with Cerner in 2017. That was a very traditional implementation that did not necessarily go as expected, but we got through it. I think what we've tried to do over that time is my position, like Holly had mentioned, has evolved in integration and performance, where we're really trying to move the implementation with the science and with the outcomes, and really focusing on that as the driver, not necessarily IS be the driver. So some of the areas that I have is the traditional IS areas, but also created a clinical transformation area, which is staffed by a provider, a set of providers, and they focus on evidence-based medicine. So when you think about our patients, they need a care plan to manage the complex conditions. We implement that evidence-based care. And then we also have an outcomes department that we've started. And that's where it does touch on Notable again, too. So the vision ultimately is, and we're starting to work on this, that you have the whole front-end process all the way through prior authorization, referral management, but then we can implement our patient-reported outcomes within a Notable platform also. So we, like I had mentioned earlier, getting back to Holly's point, one of the things that we have, the challenges we have is, like I said, we're as complex as anybody, because of the complexity of our kids, but we don't have the economies of scale of a large academic medical center or things like that. So we're really reliant on really good partnerships in order to get our technology implemented, because we're not going to have a big shop of 30 developers that can work on stuff. So we're really dependent on the partnerships.
The partnership is a good tone. We mentioned the orders-based scheduling, that the multi-factorial episode of care was something they said, hey, can you help? We're like, sure, try. For those of you in the room that are on Cerner, you'll know that there's not actually an API for orders-based scheduling. So this is something that we've had to build out with our partners where we're doing that work. And I think the Gillette team has come equally to the table with that innovative mentality.
I agree. And I think we bring a lot of the content to the table, the intellectual property about what it means to care for these kids. Notable really brought the technology. I tell the story about early on, kind of Pranay and I were talking about the challenges of this. And I think the mutual conclusion we came to is, when we do this for Gillette, when we do it for these kids, we're going to learn a lot, and it's going to prove that we can do it for just about any complex, condition. And I really appreciated Notables just stepping up to that challenge. I thought that was a really great early indicator that we're both in this together.
Likewise, Carrie, there have been things that we have collectively decided are not worth pursuing. So maybe talk through some of the work with the team and how we approach the innovative partnership and make sure we're always targeting the outcomes on both sides.
Yeah. So I think one of the things that's unique about Gillette, everyone is singularly focused on the mission of reducing friction for families as they move through the system. And that really drives a lot of clarity when we're making decisions about what to pursue and what not to pursue. The other thing I would say, and let me caveat this by please do not poach anybody that works at Gillette, even though they're fantastic. They are by far some of the best analysts and project managers I've had the opportunity to work with. And part of my previous career was in consulting, so got to see a lot of different organizations, and they're so content rich. They know Gillette in and out, and they're passionate about what they're doing. And we're able to leverage their expertise and their perspective in ways that makes us a lot more effective while we're working with them remotely. So there's been a lot of things have changed, I guess, in healthcare in the year since we've worked together. There were some things that were a priority last September that weren't a priority this September around COVID. We're not looking at the travel screening questions anymore, some things like that. There's also a lot of unique workflows at Gillette that we've got an opportunity to be helpful in the problem-solving process, but it's not something that we're going to be able to address completely. I think one of the good examples there is when you are referred to Gillette, you schedule, you make an appointment, but there's a pretty involved process for collecting records. And a lot of that happens during business hours as well, so it's impactful to families. We've been able to work with the Gillette team to think through these are areas where we can use the tools that we already have live to take on some of that work, take that lift off of the referral management team, and then also the parents as well, and family members, and coming to solutions that way instead of looking for something that's in a box, already packaged and ready to go, has been really helpful as well. A lot of this ends up driving the notable product altogether. We're certainly not doing any custom development work for Gillette, even though I got to be disciplined about that because we could get into some sticky patches with the engineering team really quickly, but there's a lot of great opportunities there. In the year that we've worked with Gillette, we've been live, we've had one product request that was Gillette specific that we've used. Everything else has been working with Gillette to help push the notable product forward more broadly. I think we were talking about the grouped encounters earlier and having one registration per week. And we were able to settle on that one really quickly because we had to configure that for Gillette. We had to go live with some creative workarounds there to make it happen. And as we're working on developing that product and rolling it out more broadly, we could look at Gillette's data and say, this grouping it by week is giving us the right balance of patient satisfaction, completion rates, but also making sure that we've got correct registration information, correct insurance, things like that. And so I think that's really where the partnership has been most impactful, is some of the nuances there and being able to look and see how do we try to solve this problem for Gillette and how can we use that to push the product forward more broadly.
Yeah, it was really fun to see other customers reference that type of functionality here at the conference. So that I think just reflects, very much on our partnership.
Awesome. Well, I think we could open up to a few questions for folks in the room. We've got an intimate group. I don't know if we have mics or if we need to pass them. I think we could probably hear. But if there are folks that have questions, either from
for the video, we need to.
You have a fourth mic. Okay. Pranav, do you want to grab it? Thank you, Carrie. I'll get in trouble with the marketing team. But if you have questions either for, I know there are some folks in the room that are earlier in their journey from an implementation partnership approach. Obviously, we have a great wealth of experience with Carrie, and then also specifically to the Gillette experience. I think we've got some war stories and some great success stories on both sides.
So, hi, thank you so much for sharing your experience. We're also a Cerner shop, so really interested to hear about that complex scheduling piece with, you had mentioned like ortho and like getting the x-rays. Seeing a similar kind of use case in our institution and that complexity for some of our specialty like imaging and specialty visits. So just wanted to hear a little bit more about what that looks like and if that's something that's currently live or that you're actively working to get live soon.
So we are working on that for Q4. We have, I think, 25 orders in scope, and that ortho plus imaging is one that requires a significant amount of engineering work. So we've gone through the requirements process. We've understood like what has to happen on the Gillette side, like what they need to have a completely hands-off experience there. And our engineering team is working through it right now. There's a couple of API components to that one in particular. So all in all, very exciting stuff all the way around. But I think it's going to be so valuable, not just to Gillette, but more broadly, being able to like actually use online scheduling for everything.
And how many orders are we live with now, Carrie?
We are live with 4 different orders. We've got 25 in scope, and there are, I think, 8 that are getting ready to go live in the next couple of weeks.
But it's that complex episode of care that's in progress. And I think we should disclose, right? This does require work on the Gillette side as well. This is
So just a quick question. We're partnering with Children's Hospital, bringing more care to our area with the specialists. Does the product also help, again, scheduling, but understanding if I'm sending for the scoliosis evaluation, here's what you need to order also, and then it puts out the everything that needs to be scheduled first, and that how can it help the providers understand that aren't familiar with it, get the right orders in when they are going to the specialist?
I can speak to the product side of that, and then we can talk about the workflow as well. So the way we're partnering with Gillette on that is grabbing those referrals after they come into the system. So there's a couple different ways that they get them, like through faxes. There's an online form on the website that they're able to submit as well. And there's also, I think, a decent amount of provider education that's happening in the community to help guide them to order things correctly. From a workflow perspective, anything you'd add?
Yeah, a lot of that happens within Cerner. We build the order sets within Cerner, so that provider will be able to say all of the different components that they want to order for that. And then Notable is able then to look at those orders and understand which ones need reminders or which ones need scheduled and things like that. So it is very integrated.
Oh, I was going to say you all have done a fair amount of community education with the referring providers. How much of that have you enabled it to be? I think what Dr. Cogley's probably asking about is a little bit of an easy button if they're not as familiar with what are all the orders that are necessary with this particular diagnosis.
I think that's part of what Carrie was referring to with processing the referrals and why that's going to be so important for us, because the referrals come in with very little useful data on them, is the reality. Because the primary care provider does not understand the complexity of cerebral palsy or even know that the kiddo has CP at that point. They're just developmentally delayed or something like that. So the referrals we get do need a lot of work in obtaining outside records and then making sure, based upon the provider's scope of practice, we get them to the right place.
So from understanding it, it's more you build the order set so they're ordering the right things. Then on the other side, when Notable receives the referrals on that, then helps sequence everything that needs to get done, that the imaging has to be done before the appointment, the blood work has to be done before that, or whatever it is.
Yeah.
So that scheduling aspect, so the provider doesn't necessarily need to make sure you get this a week ahead of time because it needs to be done and read and there, or you go the blood work first and those type of things, then that for
so that's
the patient.
Part of the logic of the orders-based scheduling that we're building out. That's where I guess that lands within the Notable product. For example, like those ortho visits, there's a time frame that we want the imaging appointment to happen in, and we are factoring a couple of different things there, like what's convenient for families, when do we need to have this done by for the image to be ready for the provider, those types of things. So I think that's getting at the nuance that you're talking about there about like how you actually schedule correctly. And this has been such a challenge, I think, in trying to introduce online scheduling more broadly from like whatever tool is that there's a lot of complexity in scheduling, and it's not like me making a nail appointment or something like that. Like there's a lot of logic that goes into it, and we need to make sure that if we're providing this online experience, that it's actually like taking that workload off of people and providing that seamless experience for families.
Hi. So I'm really interested in, like, I was very impressed by kind of like the timeline with which you guys roll out things. And I've heard you talk about this is a constant iterative cycle where you're constantly looking to see how to improve it and then making the improvement and then watching the data to see what the impact is. From a kind of a change management perspective, how do you constantly be introducing new change to a workflow to like a large staff that's everywhere? And also it sounds like a lot of things are then changing for the patient too, because maybe they've entered something one way 1 week and a couple weeks later there's like new features and stuff. Like, how do you approach that?
I'll let you grab that.
Okay. No, I think from a staff standpoint, it's been a really welcome change because they see the impact that it has on the family, and they know that they're having a good experience, and that makes the staff really embrace it and want to provide that, support that good experience. So they're pretty active and pretty engaged, and Carrie can talk about the project team is a very engaged and focused team, so they're very good at not just receiving a product, but actively being involved in understanding and making what it's going to look like. So they're vested in it, and I think that's made a big difference when it comes to the change management and the implementation.
Are you like constantly training and retraining staff? How are they knowing that something new is rolling out?
Yeah, I could probably speak to the mechanics of that a little. There are two things that I think are like really big communication channels that we use for the update. So when we went live initially, we did about a 30-minute training with everyone. We recorded that, so it's part of the onboarding process now. Now, the goal here is to just teach people to not do anything, which
I was going to say, just to clarify, right, that the hardest change management, you heard this from a couple of folks on stage, is getting staff to stop doing things. It's not to get them to do other things.
Yeah.
And so frequently when we say iteration and new work, it in some cases doesn't even touch the staff. Mm-hmm. It's us tweaking the workflow for the patient such that it's more streamlined, more efficient, right? We rolled out insurance V2, which, reduced drop off. Nobody on the staff side really saw that other than continued happy patients. I think, Carrie, it's probably worth touching on that. And then secondarily, as we look at like the authorizations work, the referrals work, or the scheduling work, there are pieces that do impact the staff on the back end that aren't as frontline staff facing. But it again becomes, what are the chunks of work that we're taking off their plate, not asking them to do differently in some cases.
Yeah, I think there are two things that Gillette has done that's really helped push this out. And they've got a very cohesive team across all the different locations. So there is a newsletter that comes out every Tuesday that has a lot of content in it as far as like what's going on within the department, what the changes are. They also have a Teams channel where they can quickly talk to somebody about like what they're seeing if like a patient reports something that they didn't expect. But to Holly's point, like it seems simple, but sometimes it's a really hard thing to get comfortable with. It's like stopping doing things. It doesn't always feel great. Like you feel like you're dropping the ball there. But as we iterate, once they're used to the fact that like the notable bot is going in and updating fields within registration, they'll see what's been updated. And if we add a new field to scope, that is very intuitive at that point. So that's how we, I think, manage it from that perspective as well, if that makes sense.
I would say the other thing that I've seen you all do well is sharing those outcomes, that storytelling that you heard from a couple of folks on stage, which is so core and second nature to your culture, seemingly from the outside.
No, definitely. We definitely go into this thinking about what the impact for the patients are going to be. And I think everyone is unified in that at Gillette, and that's been really helpful. It's a big eye change for me coming from a large academic medical center where there's quite a few egos like in the mix as far as decision making and things like that. At Gillette, it's always been about how does this help the patient, and that patient experience. So all of the staff, and anyone in healthcare, I would say, is in it because they want to help people. But I think the filter I think that Gillette has is it's hard work to work with these families. You could be a nurse, anywhere. But if you choose to be a nurse at Gillette, there's a reason why you're highly engaged and really wanting to help these families. So anything that they see that can help the family, they're all on board.
I have a question. My name is Paul from Sturdy Health in Massachusetts. I'm a fellow traumatized Cerner user. I'm just wondering from your perspective, was there anything that you wanted to do with Notable and Cerner that just you couldn't do? And then was there any projects that you were waiting on Cerner to respond that took a long time?
I feel like the Cerner integration has been very smooth, at least from my lens. We haven't had to get Cerner engaged much at all in this process. It's all been just direct through Gillette and Notable. So the most complex thing we've talked at length about, which is the order-based scheduling, has been the challenge. But we had that challenge when we implemented Cerner too, because they didn't really understand it either. So,
Carrie, don't they have some really magician-like analysts on their staff?
I hesitate to say this because they're wonderful. I can't say enough about Virginia. She's the best. She can make Cerner do anything, and she really understands what is important at Gillette and understands every workflow like the back of her hand. She manages a lot of the reporting as well, and she can just turn things around so quickly. Before you can log a ticket, Virginia's already fixed everything. I think one of the things that was challenging about working with the EHR vendor there, initially we had some difficulties in getting access, but the great thing about just using APIs and the RPA processes, once you're in, and we don't need to engage them anymore at that point. We're not making a lot of tweaks to the integration.
So fortunately or unfortunately, I'm another Cerner client.
wow, we have a lot of Cerner people here
Well,
today.
probably because you guys Cerner. So I think that a few questions. First question. So you are on Cerner Millennium.
Yes.
Okay, so that's good. Second thing is order-based scheduling. And does patient does the scheduling themselves, or physician does, or how that works?
The physician puts in the order, and then
To where in Cerner?
into Cerner. And then
do that.
Notable, I don't want to oversimplify the process. Notable can then read those orders and prompt scheduling for the patient.
So this makes your life easier. We have a community physicians, and they just give a piece of paper to the
Right.
patients, and then or they fax it or they give it to the patient. I think that's a challenge that we have.
Right.
Yeah, I mean,
And we have
gonna
that too. That's, as I mentioned, as we start to tackle referrals, you can imagine the complexity of these kids. The primary care physician has very little understanding or knowledge of what's going on with the kid at the time they refer to Gillette. So we'll get fax referrals, thousands in a month, just basically saying, I think this person should see a neurologist or something. This kid should see that. It doesn't really have a lot of information about what's really going on.
I'm sorry, I keep asking more questions.
Well, I was going to say it might be helpful, Carrie, if we back up a bit. So highly specialized care, where we are going next and some of the work that the teams are taking on is actually to ingest the referral, apply NLP, OCR and NLP to read the referral, then place the order where possible. Now, not all of them will be possible. This is one of those workflows where a human might be in the loop for those that don't have enough information and then trigger the prior authorization, which is the other piece here, which is the majority of care needs a prior auth.
Yes.
And then that goes into then the scheduling piece.
I'll leave my question later on. Ask you.
Okay.
Are you Cerner client too?
I am a Cerner client.
Hey, for what
feel your
it's
pain.
worth, we have our best stats on our Cerner clients.
I'm guessing that's why we're here. Oh, that's great. We're new on the Notable journey. We're actually just going through our testing today and going live next week. I just want to hear more about the partnership and the journey just to know what to expect from that. I mean, I think most of us in every implementation we've ever done, you get your implementation team and then they go away and they hand you off to a call center, essentially. So just help me out more about what my next year, 2 year, 5 year, whatever, what is...
You want?
Yeah, I'm going to hear it from your perspective first.
I agree with you. That's the experience that I'm used to having, kind of from a technology standpoint. That's the experience we've had with Cerner and things like that. So I do think that's unfortunately part of the norm in the industry. But when we approached this with Notable, I do think from that very early on, it was like an appreciation for the complexity that we have. We appreciated the fact that Notable was willing to step up and partner with us on that. And I think we've been pretty tight going forward. So it has been different in that regard, where we feel like, and I think somebody in the earlier sessions talked about this too, this feels more like a partnership rather than we bought a product. It's more we have a partner.
I would say the other, and I'm looking at some of the other faces in the room and probably that have had similar journeys. We've also never been done with implementation because we keep adding additional use cases.
Yeah.
And so I think there's a different mode of operating with, the solution sets where we are in active implementation versus those that have hit more steady state and we're constantly, refining. So Carrie, it might be helpful from the partner delivery side to even separate in the Gillette world, right? What is support on registration and intake and some of the upgrades and enhancements look like versus you're in it deep on scheduling right now?
Yeah, so one of the great things about the way we've staffed the Gillette project, we've got a core group that's working with a lot of the different solutions. We typically base this solution by solution, so you'll have an SDM assigned for intake, and then if you're doing prior auth, you'll have another one there as well. The way we've staffed this at Gillette is understanding that there's some real uniqueness there and a lot of knowledge transfer that has to happen. We've condensed that team down. And so now where our focus is, we're not making a lot of updates to the registration forms, things like that. That's pretty static at this point. A lot of it is tweaks to okay, we need a new consent form or a new virtual consent form, those types of things, maintenance-y things. But a lot of the time there is spent working through additional clinical forms that can be impactful to the intake process. I think probably my favorite one to talk about is the Botox sedation form. So instead of having to have a nurse call families the day before an appointment, we're able just to send that form. And if they send it back, we know we don't need to make a phone call. And everybody's happier because of that. So that's where a lot of that effort is now. Now that Gillette really understands the product, understands where it's been most impactful, and knowing that we can't cookie cutter the implementation here because of the complexity and uniqueness of Gillette. Pulling those Easter eggs are pretty exciting. When you're able to save 7 minutes per intake. And pulling those out and working through the automation process. And we're also actively working on the scheduling piece as well, which is a lot of exciting testing going on. So,
but the teams do have access to Flow Studio and some of those tweaks on registration. They're doing it themselves.
Yeah. And I think the administrative burden in healthcare on all of these, a lot of them will be back-end functions, but also the front end, like registration and clinical intake and things like that. There's so much to do in this space. We found that as we do knock off something, then we're ready to move on to another thing. So it is pretty continuous. And then, like I said, eventually getting to patient-reported outcomes so we can see everything from the front end to how did it impact their care is really our vision for this journey.
Yeah, and not necessarily to sing the praises of my side of the Notable team, but I really do think that you could have a fantastic product in healthcare, and if you implement it poorly, or you have poor, you haven't really planned how you want it to be impactful, it's not going to have the same reach that you could have by a more thorough implementation process. And what I love about just the whole soup to nuts Notable process is that through the partnerships team and the solutions team, we really work through with customers what problems are you trying to solve and how do we get aligned on that, so that when the delivery team comes in, like we're very clear about what needs to happen and how we need to partner, just to make the implementation successful instead of just like turning it on and handing you the keys.
Yeah.
Awesome. Well, thank you all for joining us. Thank you to our presenters. I'm sure we'll have you all at the cocktails and dinner later if there are additional questions as well. But we'll look forward to moving on to the next session.
Good. Thank you.